Nurse Sweet to the surgical floor.
Hi there, Marjorie. How are we feeling?
Oh, not so good. My name is Jamie. I am your student nurse, and I've just checked out some of the assessments that were done on you and looked at your medical history, and I understand it was a bit of a hectic night. You had a C-section last night, and your daughter for the last 12 hours is being well cared for. I just want you to know, so take that off your mind. She's in the ICU, but I do understand that you want to see her. Is that correct? I really do. Okay, well, I think we can probably make that happen, but we do have the concerns right now of your nausea and your pain. I understand you've been vomiting, and you're at a 6 out of 10 for pain. Obviously, that's probably in your C-section area? It is, but everywhere too. Okay, well, that's understandable. So what I'm going to do is, first I just want to, would you like to tell me what your birthday is? It's April 1st, 1979. Okay, and that's Marjorie Lemon. Do you have any allergies, Marjorie? I don't. Okay, and I don't see a band there either. Okay, so what I want to do, Marjorie, is I would really love to have you see your daughter, but we need to take care of the pain and the nausea. So I'm going to give you morphine, and I'm going to give you some Gravol. Have you had either of those medications before? Yes, I have. And have you had any kind of a reaction to either of them? No, I was fine. Okay, well the morphine's going to help take care of the pain, and the nausea will be addressed by the Gravol. So let me go prepare those, and I'll be right back, okay? Thank you. You're welcome. Okay, so here I am in the med room. I've got the bar with the doctor's orders. So the first thing I do is wash my hands, okay? And I'm looking at the doctor's order, okay, and I've got the Gravol, and I also have the morphine. And other thing I'm doing now is, there's a drug monograph here. So this allows me to check out contraindications, side effects, are these drugs compatible, and any other pertinent information. And yes, I'm satisfied with that information. Okay, so now I'm looking at the doctor's orders, and I've got the Gravol and I've got the morphine. Now normally with the morphine, I would likely say I've got a 5 to 10 milligram option here. Because of her pain and the fact that she wants to get up and do something, I would probably opt to give her the 10 milligram. But for the sake of this video, there seems to be a shortage of ampules. So I'm going to use the 5 milligrams. And with the Gravol, I'm going to use the upper end of the 50 milligrams. Okay, so the 50 milligrams in the Gravol is 1 milliliter, and the 5 milligrams of the morphine is also 1 milliliter. So I'm going to end up with 2 milliliters in total. So the first thing that I want to do is get my 3 milliliter syringe out and get my blunt filter needle out, like so. Okay, and I'm going to inject 1 milliliter of air into my vial here. And okay, I've taken my swab out and I've cleaned the top. Just make sure that it's nice and clean. Now I'm taking the top off my filtered needle. Okay, and I'm injecting that milliliter of air in carefully, like so. Okay, I'm going to put that back in there. Okay, so now what I'm going to do is put this to the side. Got my ampule here. Make sure that all of the fluid is at the bottom of the ampule. And I've done the math here where 5 milligrams per milliliter, I need 5 milligrams, so I'll be taking the milliliter. Okay, so for safety, I'm going to snap that like so. Put this in my sharps. Okay. Take my needle cover off and draw up my medication, which will be a full milliliter. I'm just going to pay attention to where that liquid is and the bevel on my needle. And I've got exactly 1 milliliter. Okay. So that. I'll now put my cover back on very carefully. Okay, so now I don't need this filtered needle head anymore. I need to switch over to the needle I've chosen for the patient, which is a 22 gauge 1.5 inch needle. This is based on her muscle structure of her leg, her age, her size, and this is the one that I deem to be the best. So I'm going to take this one off and carefully put this one on, making sure to keep my hands away from everything. Okay. Now I've got my 1 milliliter drawn up already. Now I'm going to draw up my gravel. And there was no need to waste... Oh, but before I do this, this is an important thing. I'm going to need somebody to come and check this morphine, am I not? Nurse Gower, are you busy?
I am not.
Okay, I've got my 1 milliliter of the morphine.
Okay.
It's 5 milligrams as per the doctor's order here. It's
All right.
right here. I just need you to double check that as an RN.
Okay, that's your milliliter. Alright, you're good to go.
Thank you very much. Just gonna make sure. Okay, so now I'm ready. I already put my air and clean vial here, and I'm gonna draw up my 2nd milliliter of the gravel. Like so. Okay, so now what I'm going to do is double check that. I've got my 2 milliliters. I'm going to place the cap back on, like so. Just going to tidy some of this out of my way here. And now I'm going to grab a label. And I'm going to fill it out with the appropriate information, i.e. the patient. Names of the drugs, room 213, morphine, and this is my opportunity to check it again. 5 milligrams of morphine per milliliter, 1 milliliter, check, and the 50 milligrams of the gravel I'm giving per milliliter. So again, I've got 2 milliliters in my needle, ready to go. Name, date, and time, and now I'm going to stick this on the needle cover so it doesn't obscure the view of the medication in the needle. And I'm going to take care of that ampule into the sharps and get rid of the rest of this. And now with my MAR, I am ready to go give my medication to the patient. I'll see you there. Marjorie, I'm back. It's Nurse Sweet here again. Just want to double check your April 1st, 1979, correct? Yes. And your Marjorie Lemon, and checking for that allergy band. No allergies. No. Okay, so the only thing I want to let you know is we are going into a muscle here. It's called an intramuscular injection. As such, it will have a faster onset, but it may cause some slight burning or stinging. But it's kind of offset by the fact that it has a faster, it'll take effect faster. You'll feel better faster. Okay? That's great. Okay, so I'm just going to save my back here. Okay, Marge. Let's make this happen. Just flipping up here. Okay. Now, you don't hear this, but for the sake of my teachers, I just want to talk about how I'm going to landmark this area. Basically, I'm looking on the side of her hip here, and the way that I'm going to landmark it is, basically it looks like this. And this is going to point towards her groin, and I'm feeling for the greater trochanter, and from the front pointing finger here, I should feel the superior, anterior, iliac spine, and these 3 fingers should be able to palpate the iliac crest. Now I can feel all 3 of those, and I'm satisfied. So what I'm going to do now is I'm going to pull back on that skin about 3 centimeters, and I go outwards with my alcohol swab there. Just going to give that a second, just to let it dry. Okay, and now I've got that flap of skin pulled back appropriately. Take my needle out, and like a dart, going in. First thing I'm going to do is slowly aspirate, see if I get any blood, because I don't want that. I need to know that it's in an area of the muscle that's not vascularized with blood. And I've done that slowly, and I'm satisfied. So now I'm going to allow the medication to go in to that area at the rate of 1 milliliter for every 10 seconds. So in this case, that should make for a 20-second injection. Okay, 9, 10. And 20. Now I'm going to hold it for an additional 10 seconds. 7, 8, 9, 10. And now I'm going to slowly and carefully pull that needle out. I'm going to put some gauze on there. Just going to hold that for a moment. Just going to check it. Nope, no bleeding there. Okay. You okay? Yeah, that wasn't so bad. Okay, great. Now I'm going to recap my needle. So, I'm going to go take care of that in the sharps, grab my stuff in the MAR, because I need to go document everything, and you did really well there, and medication's going to take effect, and you're going to feel better, and we're going to go see your daughter. Oh, thank you. Okay, I'm off to wash my hands.